In British Columbia, our goal is to have the best ambulance system in the world, providing the best possible service. When we need help, we call 911, and we must know that help is on the way and quickly. That's the commitment, the unspoken partnership. As our COVID-19 case counts declined and our comfort with returning to the healthcare system increased, so did our calls to 911 for help when we felt it was necessary. And most recently, the extreme heat wave, one that claimed the lives of many people, added to the expectations of our emergency responses. All of these events have brought a focus to this fundamental partnership. When we call 911, we need an ambulance. We need to know it's on the way now. As government, we recognize the importance of the ambulance service, and since day one in 2017, we've worked to make it better. Since 2017, we've increased the BC Emergency Health Services budget from $424.25 million to $559.12 million, which is a significant increase. We've doubled the average annual spending increases compared to previous years. This has meant more paramedics, more dispatchers, and more ambulances on the road. Between 2017 and 19, BC added 119 paramedic positions to support direct patient care, improve service and response times, and modernize dispatch operations. Since January 2021, 271 paramedics have been hired by BC Emergency Health Services. We negotiated the first collective agreement in recent times with QP Local 873, the union representing BC Emergency Health Service workers. And in fact, we gave them, that union, that bargaining unit, the ambulance paramedics at BC, the right to negotiate directly with us again solely in support of the services in the ambulance service. And these are all important steps. But the events of the last few weeks make it clear that there's more work to be done. That essential partnership, the necessary confidence that when we call 911, help is on the way, has been tested. And now it needs to be strengthened and restored. Let there be no doubt our emergency health service system must work better for the people who call upon it and for those who answer the call for help. We know that all British Columbians, regardless of where they live, count on timely and effective access to emergency services, not just for themselves, but for everyone. When you call for an ambulance, it becomes the most important public service government provides and a community can provide. And I think that I want to note the pressure on the ambulance service in this period has been considerable. And I just want to put it in context. We have in our ambulance service a number of different types of calls. The most urgent calls, high priority calls, are purple calls, then red calls, and orange calls, and then yellow calls. But purple calls are calls that are deemed life-threatening calls, and we've seen a very significant increase in those calls. But I want to give you a sense of the kind of increases in 9/11 event volumes we've seen in the last couple of years that have really spiked since we've started to open up with our renewal plan on May 25th. Overdose cases, when you compare the first 6 months of 2021 to the first 6 months of 2019, compare those periods, have increased by 28%. That's 3,530 increase in events, one period compared to the other. Chest pain, 11% increase, or 2,136 increases in events. Abdominal pain, 14% increase, 1,174 increase in events. Heart problems, 24% increase, 1,068 increase in events. These are the challenges facing our ambulance service. And as we've increased the budget by 7.9% a year, so have the demands on that service. And we need to respond and meet the test of those demands to provide the service people need. And that's why today I'm announcing measures to renew BC's ambulance service. This effort builds on the progress we've already made. It strengthens BC's ambulance system. It ensures BC's ambulance system is faster and more responsive to British Columbians. It makes BC's ambulance system a better place to work for paramedics and dispatchers. And it ensures BC's ambulance system can rapidly meet changing demands and needs through focused and direct leadership. To ensure the direct leadership of ambulance services, I'm reconstituting the BC Emergency Health Services Board of Directors to focus solely on ambulance services. The board will be directly accountable to me with a clear mandate to ensure better service for patients and families who rely on the service and better supports for workers who deliver the service. Chairing the board, and I'm very proud to announce this today, and he's here with us today, will be Jim Chu, the former Chief Constable of the Vancouver Police Department. Jim Chu has extensive experience leading frontline emergency service in BC. He'll provide the focused governance leadership BC Emergency Services needs to be an effective and high-performing ambulance service. In addition, I've asked, and he's accepted, Darren Entwistle, the President and CEO of TELUS, to serve as a special advisor to the board. I'm also directing the BC Emergency Health Services now be led by a Chief Ambulance Officer responsible for the day-to-day management of the BC Ambulance Service. And I'm appointing Leanne Heppel to serve as Interim Chief Ambulance Officer. Ms. Heppel's role is to focus solely on ambulance services, working shoulder to shoulder with paramedics and dispatchers to deliver the best ambulance service in the world that provides the highest level of service for those who need help and the strongest support for those who deliver it. Ms. Heppel is a trained clinical nurse specialist currently working as Providence Healthcare's Chief Operating Officer, Acute Care, and Chief of Professional Practice and Nursing. She has 20 years' experience with Vancouver Coastal Health, Fraser Health, and previously with the BC Ambulance Service. This is a critical role, and Ms. Heppel's experience and expertise will serve British Columbians well. We are acting immediately to reinforce ambulance operations. We're providing funding for 85 new full-time paramedics, 30 full-time dispatchers, 22 new ambulances, and moving to convert rural ambulance stations to 24/7 Alpha stations in response to needs in the interior of British Columbia in particular and on Vancouver Island, where the demands and needs of ambulance service are different but equally required. To get paramedics and ambulances back on the road more quickly and responding to patient calls, I'm directing health authorities to add more staff to receive patients and care for them when they arrive at emergency departments. This will have, I think, and many people, if you speak to ambulance paramedics, will tell you delays in being able to deliver and then leave emergency rooms for ambulance paramedics is an impediment to the delivery of service, and we will work to ensure that that changes. This immediate action on operations, as well as stronger leadership and increased investment at BC Emergency Health Services, will deliver a more effective ambulance service for patients and families depending on it. And of course, we have to support our workforce, our ambulance paramedics, our dispatchers, who continue to deliver extraordinary responses, I think, during two public health emergencies, both the overdose public health emergency and the COVID-19 public health emergency, and in circumstances and challenges like we've seen with extreme heat in recent weeks. The backbone of any ambulance service is people. I know that our emergency service staff are feeling overwhelmed and frustrated, whether it's helping people with COVID, the toxic drug supply crisis, or the heat wave. Their every action is motivated by a commitment to provide support and care for all of us. It's time for us to do a better job providing support and care for them. I'm directing BC Emergency Health Services to take immediate action to support workers, in addition to the significant actions that have been taken pursuant to the collective agreement we signed with CUPE Local 873. As a first step, BC Emergency Health Services will contract a team of mental health and wellness professionals to work directly with dispatch staff and paramedics to address chronic stress, fatigue, and support wellness among staff. British Columbians expect BC Emergency Health Services to be an employer that fully supports emergency workers in the crucial work they're trained to do and are committed to doing. This action taken today ensures achievement on that front. To ensure British Columbians who call for help get the quickest and possible emergency health response, we are returning to pre-COVID-19 first responder dispatching practices for 911. The province is also directing the Emergency Medical Assistance Licensing Board to complete their examination and recommendations on the expansion of firefighters' scope of practice. The deadline for recommendations will be September 6, 2021. Consultations with stakeholders will follow those recommendations, but a decision will be made presently. We need everyone providing emergency services to be all in together. And the measures I'm acting today will benefit from continued collaboration between BC Emergency Health Services and the ambulance paramedics of BC. They are working together right now and have identified, and we'll be sharing this with you, a range of measures to address employee wellness, operational performance, workload, response times, recruitment and retention, and public engagement. And that work has been going on, and I thank the ambulance paramedics of BC, QP Local 873, for their work with us over the last number of weeks to make improvements in all of these areas, and our commitment to work together, I believe, on both sides is profound. We recognize the importance of this work, and we strongly support the constructive and cooperative approach we've seen from everybody. The work to make BC ambulance service the best in the world for those who count on it and those who respond to the call for help starts today. I want to thank all of our emergency services workers who are working flat out right now. Yesterday, 1,711 calls to BCEHS. The pre-pandemic normal was 1,540. And 1,711 was less calls than we'd received the previous 7 days. The pressure, the consistent pressure, the demands on our ambulance service continue to grow, particularly in our most serious calls. I want to thank all of those workers who are involved in that right now. And once in place, the new board and chief ambulance officers will immediately act to ensure faster ambulance response times for all British Columbians, work with the union to focus on areas where the challenges are greater, and by no later than fall 2001, provide advice to the government on the resource and operational changes necessary to achieve BC Emergency Health Services renewal and the promise it holds for us all. When we need help and we call 911, we need to know, we must know that help is on the way and quickly. And that commitment, that unspoken partnership is powerful and essential to so much of what we all believe about our healthcare system. We won't stop until that commitment is fulfilled. I want to now take a moment to ask Jim Chu to come up and say a few words, and then we're happy to take your questions. Jim?
Thank you, Minister. Good afternoon. Let me begin by first thanking Minister Dix for asking me to take on this new role. The reason I said yes, I think I speak for all British Columbians when I say that when you call 911 and ask for an ambulance, the help is on the way promptly. In my 35 years as a police officer, I had the opportunity to work with many frontline paramedics, and later in my career, I worked with their leadership teams. I look forward to reconnecting with some of those old acquaintances, but I especially look forward in my new role to connecting with frontline paramedics, frontline dispatchers, meeting with them, speaking with them, finding out the challenges they're facing on the front lines every day while they serve the public in British Columbia. I also look forward to working with their union leadership. I think with our new Chief Ambulance Officer, as well as the input of our employees, I think we can be collaborative, reach consensus to make the ambulance service as efficient and as effective as it can be. In closing, I also want to say that it's really important that we create a supportive work environment for all our frontline workers, and I look forward to working with our employee groups to make sure that the employees feel valued and supported. Thank you.
Thank you, Jim. And I just wanted to say that, I spoke to Jim a few days ago about taking on this role, and his willingness to do so is an act of public service. We know that being the chair of a board such as this is a part-time position, and it's in addition to his considerable responsibilities in his full-time job. And the fact that he stepped up immediately to take this on is I think, a tribute to his commitment to people in BC, and I'm so proud to have him with us as we move forward with these changes. So with that, happy to take your questions.
As a reminder to reporters on the phone, please press star 1 to enter the queue. You will be limited to 1 question and 1 follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Richard Zussman, Global News. Please go ahead.
Minister, you're well aware there are people now who call for an ambulance and are waiting hours and hours and hours. How quickly will these changes actually make a difference, considering we're still expecting high temperatures this summer? Should people still be concerned that they're going to be able to get an ambulance right now when they call?
Well, over the next number of months, we're, of course, hiring in the hundreds more full-time paramedics. The fact is, as you have said, we're seeing a very significant increase in the number of calls we're receiving, and we are going to be ramping up services to meet those demands. I believe when people call 911, they should get the service they need. And over the last couple of years, our median response time, Richard, on the most serious calls has actually come down. But here's the important thing. When we're talking about purple and red calls, our most serious calls, the new standard that I'm setting is not just the median, because the median is important. It means as many calls are faster as slower. That's the median, right? That the 90th percentile, meaning the vast majority of calls, the have to come down. The response time at the 90th percentile has to come down. And that means that all people who are in the most serious categories, purple and red categories, need to get response within what is a reasonable response time. And that response time at the 90th percentile is the standard that we're going to set from now on for our ambulance service. We're going to provide the median information, and it's good information to have, but we should have a high standard. So if you're asking what's happening are immediate changes in leadership. Ms. Heppel, Mr. Chu. What's happening is immediate support in terms of resources. This past year, and we've seen over the past number of years an average, since I've been Minister of Health, of 7.9% increases, other than mental health and addictions. The highest absolute increases we've seen in anywhere in the healthcare system since 2017. And so we're going to work hard to meet those demands and work with the ambulance paramedics of BC to see that happen. And I think the work we're doing together now, the work we're doing to help people get back to work when they've been injured, whatever the nature of their injury is, that work is going to have some benefits immediately. And but these are immediate actions we're taking to make things better. And I think the plan is strong in all the ways it needs to be strong: leadership, resources, improvement on the ground, improvement in the way ambulance services get in and out of ERs, for example. These are all significant changes that are going to improve response time, in addition to the extraordinary investment that we've made over the last 3 years to increase and improve the ambulance service. This is a cultural transition as well for the ambulance service. We've started, when I became Minister of Health, roughly 35% of ambulance paramedics were full or part-time positions. Most people were on call. We're slowly making that transition of bringing the ambulance service into the 21st century, and that's where we've seen hundreds of new full and part-time employees in the system. But we need some immediate action, and that's what this plan demonstrates.
Richard, did you have a follow-up? Richard, do you have a follow-up?
I do. Can you hear me okay? Can you hear me okay, Minister?
I can hear you very well.
Sorry about that. We've hit the significant milestone yesterday of 80% immunizations among adults. Are you concerned that we have hit our plateau in terms of adults getting vaccinated in this province? Are you concerned that there is still room for the Delta variant to grip hold, considering what we've seen in some European countries that also have high rates of immunization? And what is the immediate plans being done to get more people vaccinated? And do you have a target number for the number of people, percentage-wise, you'd like to see immunized with at least one dose?
You know that our target is always going to be 100%, Richard. But I would say that last week, just as an example, the week ending Saturday, 444,000 doses of COVID-19 vaccine delivered. Approximately 47,000 of those were first doses. So that went up yet another % during that week because there's 4.635 million people over the age of 12 in BC. And the remaining 400,000 or so were second doses. And we're continuing to make progress. You see, especially in areas such as interior health, a focus on first doses, that most people can walk in up to drop in first dose clinics today and anywhere in BC and get their first dose. And we are continuing to do that work. And where I'm particularly impressed are young people 18 to 24. I think if you look at registrations and immunizations, that young people 18 to 24 are going to be ahead of people 25 to 29, 30 to 34, 35 to 39, and 40 to 44 in terms of the level of immunization. The commitment of young people to getting immunized is an inspirational story of this vaccine campaign. And so we're continuing to work with them. We need more all the time to do that. We need to continue to increase the number of children and youth 12 to 17 getting immunized. But that effort is going to continue through the summer, but particularly in the next few weeks as we continue to push up those immunization numbers for first dose. The second dose numbers, of course, are coming up much more quickly now, and that's what you would expect, and that's happening, and it's very positive news. But 444,000 last week. We had, I think, a good day today. I don't know if the report is out before you, but I think a further 66,000 yesterday. I think 4,000 to 5,000 of those were first doses yesterday. So continued growth, and we're going to continue to push that number up. It's not going to go up as quickly as before, but we haven't hit a plateau. We're going to keep going and going and going. And I want to encourage anyone who hasn't received their first dose immunization to get themselves registered and immunized. There will be an opportunity virtually right away to do so, and now is the time to do it. It works in their interest. It means they'll get their second dose more quickly, and then they'll have gone through their 2 doses of vaccination for COVID-19. And I'm very, very impressed with the campaign and the effort being made. I want to signal, for example, the community of Richmond, which is now above the provincial average in terms of immunization. It was below some time ago. The significant efforts in many communities in the interior where we're seeing an increase in immunization. And I think we just have to continue to do that work. And I think it's there for us. We're going to continue day into day, week into week, make progress on first dose immunizations. We haven't stopped yet. Today, I think it's 80.3% of adults. I think it's in the neighborhood of 79.3% of all those over 12. And those numbers aren't going to keep going up. They're not going to go up multiple percentages in the course of a week, but they're going to keep going up, and we've got to continue to see that. So if you remember the week before this one, so the previous Saturday, it was, I think, 49,000. This past week, 47,000 first dose immunizations, and we're going to continue to make progress on that through the summer and get those first dose immunization rates up. We should do that. It keeps us all safer. It keeps our families safer. It allows you to do more things. For those people interested at all in travel outside Canada, it will be an absolute necessity. And so let's get immunized.
Our next question is from Marcella Bernardo, News 1130. Please go ahead.
Hi, Minister. Wanted to just start off by asking you about what improvements can be made when it comes to fast-tracking these services so that first responders are more coordinated, that we're seeing firefighters working with paramedics instead of contrary to each other, as we've seen in recent years about complaints being made about this first responder process. So if you could elaborate more on how this new system is going to make it easier for people to get that urgent care as fast as they possibly can. And if you could also just elaborate on the concerns being raised now about life labs delays processing COVID tests that we're hearing from some travelers telling us it took 6 days to get their results. So they had to isolate after being fully vaccinated.
Let me say, first of all, that I think all of our first responders do exceptional work in BC. We see this, of course, right now with wildfires that are plaguing our province, and the courageous work of those fighting those fires and coordinating that response. Our police, our fire, our ambulance paramedics do exceptional work. The purpose here is to ensure that everybody can contribute to the full extent that they can contribute. And that's why we're calling on the board to review the scope of practice of firefighters. And we're doing it at a time when the number of the most serious calls, ones that all require an ambulance paramedic, are going up. In other words, at a time when we're expanding essentially the ambulance service, we're also going to be working more closely with firefighters to ensure that the response is collective and that one reinforces the other. So the changes we're proposing today to ensure that firefighters can do more, and the recommendations that we'll be hearing on that subject, and there'll be work done. But there's a deadline to those. That's September 8th, and we're going to be expecting recommendations from the board at that time, and then we'll work to act on those recommendations. And there's some complexities here. There's different orders of government, but I think everyone's all in for this, all in for responding together, all in for supporting one another. And when I talk to ambulance paramedics and firefighters on the front line, they actually continue to work together very strongly every single day. And I think we haven't seen the level of cooperation as well between ambulance paramedics and BC firefighters. I want to give credit to the leaders in both organizations who work together closely to improve services for people. It's all about the people who call 911 ultimately, and about supporting the workers who do this important work. And I think the change we brought about today that will make serious evidence-based recommendations on expanding the scope of practice of firefighters and significantly increase and support our ambulance paramedics are the right way to go.
Marcella, did you have a follow-up?
I didn't hear an answer to the other part of that question about the delays at Life Labs and processing COVID tests. We're hearing that some travelers telling us it took 6 days to get the results, but also wanting to see if you can offer some thoughts that you have about the death of David von Holtham over the weekend. His family is reporting he was pressured to transfer to the George Pearson Center and ended up back at St. Paul's Hospital with an MSRA infection that poisoned his blood. So if you could tell me what you've been told about that situation and what, if anything, you can do to offer his family assurances that it may be investigated.
So with respect to delays at Life Labs, I can tell you that the turnaround time for COVID-19 tests in our system, in our public system, are obviously, because there are fewer people sick with COVID-19, and I think the numbers are out today, but they're obviously encouraging. Our test positivity of those who do get tested is now under 1% in the province, and our turnaround times across health authorities are very low. I haven't heard about the issue with respect to Life Labs, and I'll look into it and get back to you on that. I'm just saying, you know, it's important and it's fundamental to patient privacy that we don't comment on individual cases in healthcare. It's obviously tragic when someone loses their lives, and our heart goes out to the families. There are specific processes in place to review all such cases, and that review will happen consistent with the privacy that we offer people. So I know the case has been brought to my attention. I've looked at it very seriously. I can't comment on it beyond expressing my profound solidarity with the grief felt by the family. And as you know, Marcella, we have in our system ways of independently reviewing such things, and we will.
Our next question is from Mike Hager, Globe and Mail. Please go ahead.
Hi, Mike.
Hi, thanks for taking the question. Just had a query about the current leadership on the website of the EHS. Does this mean the current executive team has been let go? Who's still standing?
Sorry, I'm not. I would, if you want me to just take you through. We made two sets of changes. There is, under the statute, a board for the Provincial Health Services Authority and a board for the BC Emergency Health Services. Those boards have been the same board over time, and I wanted a board in place that focused specifically and exclusively on the ambulance service, and Jim Chu will be leading that board, and obviously be working with the existing board of PHSA because there's an important joint interest in improving emergency health services in BC. With respect to the ambulance service currently, There's an executive vice president responsible for a portfolio of issues, including the ambulance service. And what's changed here, Officer Leanne Apple is working in the position by interim, solely responsible for the ambulance service. So, so the individual who currently has the ambulance service in their portfolio of responsibilities will be continuing to be working. But we felt, and I felt, we needed someone who would serve as a chief ambulance officer. That was important for ambulance paramedics, important for the public, and that's what we put in place today.
Mike, did you have a follow-up?
Yes, of course. Thanks for clarifying that. So they'll be at that executive level. You said that you want the response times to be in the 90th percentile. The key metric that the paramedics single out is nationally 8.59 minutes to have an ambulance respond to critical calls. Parts of the Lower Mainland are over 11 minutes, I think, currently, according to the union. What is the metric that you want to get to, and when? And then as well, they also say another key metric for their success is the portion of a shift where they're actually dealing with a call. Lately, it's been 100% or hovering around the full shift. And to be successful, they say they need an average of about half of a shift on a call. So those two metrics, what percentage of a shift do you want ambulance paramedics to be actually dealing with a call, and what's the average wait time that you want to get to?
Well, I think it's not 8.59, Mike. I think that's 8 minutes and 59 seconds, effectively 9 minutes, right? That's the standard you're talking about. And our median wait times have been below that, and were yesterday below that. But what I want on those purple calls, on those most significant calls, is for us to look at it differently. Not to look at the median and say, boy, that's getting better, but to look at it, to do a harder look at the people who are, after all, designated as purple, meaning the most serious of calls, and need to have a response within 9 minutes. And that's the number I want to see come down and meet that standard. And we need to get down to that standard of 9 minutes is what we expect. So 9 minutes, I think, is what you're referring to, or 8 minutes and 59 seconds. And so that's a reasonable standard. With respect to the other issue, that's a different set of issues in terms of the workplace. Clearly, our ambulance paramedics today are working flat out. We also have a high level of number of ambulance paramedics off work. And so that's why we're responding both in terms of supporting our ambulance paramedics, and we've put in a series of changes already to do that, but we need some more, and that's what we're doing today to ensure that they're back at work, they're supported. And obviously, when you have days as we have, where you were averaging pre-pandemic 1,540 calls, and yesterday, the lowest day in 7, we had 1,711 calls. You can see the demands on our ambulance paramedics. So that's why we're responding with leadership, we're responding with resources, we're responding with support for our paramedics, all of which is to deliver better service for residents and patients in BC. And that's the intent of it. It builds on the very significant move to increase the number of full-time and permanent part-time, 0.75 or 3/4 paramedics that we've made in recent years. This is a transformation that was a long time in coming. Comes after a period of relatively negative relationships between union and management, the loss of the ability to bargain by the union in that case, and all of the issues we know of in the past. Well, we need an ambulance service for the 21st century, not the 20th century. That's why we've made changes and given the kind of resources we have since 2017, and why we're going to continue to support that today, and that's the intention.
Our next question is from Penny Daflos, CTV. Please go ahead.
Hi, Penny.
Oh, hi, Minister. Thanks very much for taking my question. When the extreme heat alert was declared by health authorities and various agencies, that was the Friday, June 26th. And yet BC EHS told me they didn't go to their top response level internally till Tuesday the 29th. I just want to know, how are people supposed to have faith in this agency when it looks like the leadership is more or less intact and didn't act till the worst was over during our last crisis?
I just don't think that that's a correct analysis. I appreciate you're asking the question to get a response, and there's concern. But across our health system, we were responding to the extreme heat emergency that took place. I can tell you the work done across the health system was profound, including for ambulance paramedics and the work of BCEHS to try and respond to days where we saw more ambulance calls by a very significant factor. We're not talking about the last couple of days. We're talking about responding to 1,975 calls on the highest day of the weekend and all of the other calls that were received that you know. The effort was significant. And the demands of that extreme heat emergency, the heat dome, were profound. And the system was responding. But I think it's fair to say the response wasn't adequate to the massive increase in demand. But to say that our health authorities didn't respond is not correct. There is a system in place to ensure across the health system, whether it's long-term care, home support, acute care, or ambulance services, that we respond to such events, and the health system across the board did so. And what was extraordinary, and we know this, was how much more heat sustained over days, particularly indoors, there was than at any time in the history of BC. And obviously, it deeply affected the health of many people. And I think there are lots of lessons to be drawn from that. And one of the lessons to be drawn is around climate change, but there are many lessons to be drawn. In this case, we are meeting what has been a significant post-pandemic increase in demand for ambulance services with more supports for ambulance paramedics, more resources, and improved leadership. And when you say there hasn't been a change, we now have a chief ambulance officer, an interim, Leanne Heppel, and we now have a new chair of the board, Jim Chu, and their mandate is to ensure that we continue to improve services for people.
Penny, did you have a follow-up?
I do, yeah. Officials from the health authorities now tell me that this was the first time that an extreme heat alert that is, was issued in the region, and yet nobody knew that this was an unprecedented level of concern and danger. So, I mean, you speak about lessons to be learned. Is one of the lessons to be learned, conveying that sense of urgency, the fact that this was a life-threatening situation, this was an unprecedented level of alert within health officials. Is that something that you're going to be looking at, better conveying that messaging from health authorities?
Health authorities did deliver that message. We can discuss whether they delivered it enough, but they absolutely delivered that message. In places such as long-term care, it was, of course, felt by everybody. One of the reasons why we're going to have such a significant increase in long-term care capital and renewing our long-term care system from a physical plant point of view is because many of our long-term care homes date from the 60s and the 70s. And so across health authorities in long-term care, in home support, in acute care, the response in emergency rooms, the response across the healthcare system, I can tell you, was very strong. And I think you're quite right that the heat that we faced that weekend, particularly indoors, in buildings without air conditioning, was something that we have never seen by a significant margin. There was a heat wave in 2009, as people will remember, but that heat wave, which had a significant consequence in terms of human life, was nothing like we saw on the weekends of June 26, 27, 28, 29, those days. And so it was an exceptional moment in the history of climate in BC, of temperatures in BC, for people in BC. No one has ever seen anything like that. I live in a building without air conditioning, and obviously we felt it too. And so that focus of the healthcare system that weekend, I think the series of actions they took was considerable, but it's beyond the healthcare system. There are lots of issues to address as we address resiliency in the face of climate change. And we have to continue and to advance those actions.
Our next question is from Scott Brown, Vancouver Sun. Please go ahead.
Hi, Scott.
Hello. I just want to get a little more clarity on the hierarchy of the BCEHS. Now, you say you've directed the chief ambulance officer to be responsible for the day-to-day chief ambulance officer. So where does that put her on the role of hierarchy? Is she now ahead of the chief operating officer?
She's in charge of the ambulance service from an administrative point of view. The only person that she would be reporting to are two people. One is Mr. Chu, and the other, the president of the Provincial Health Service Authority, David Byers. Previously, the person who had the senior position directly with the ambulance service was a level below this. So what we're saying is there needs to be a chief, that at an executive administrative level, the buck should stop with one person, and that person will be Leanne Heppel. And her job will be to report to Jim Chu, to report to David Byers, and to report to me.
Scott, did you have a follow-up?
Yeah, this is on an interim basis. Is that mean there's a search for a full-time chief?
Right, and that will be the responsibility of the new board. Leanne Heppel is an outstanding public health administrator with lots of experience. She's taking on a considerable task right now and definitely providing an extraordinary assistance to us. But the job of one of the jobs of the new board will be to hire a permanent person for that position.
Our next question is from Jeremy Nettle, Toronto Star. Please go ahead.
Hi, Jeremy.
I was wondering if Mr. Chu was able just to give a bit of an idea of what he sees in the system right now and what might be the first thing that he changes or enhances, if he's able to do that at this point.
So yeah, I have him since he's as you can expect. I'd say in his defense, we talked about this and he agreed to do it on Monday, and he's been getting ready. So I think I suspect that there's a learning curve, but his strong experience will assist him in that. But I think I'll hand it over to you, Jim.
I think the first priority is to listen to the stakeholders, especially our employees, especially our union, and there's going to be lots of good ideas out there. Obviously, there's going to be budget constraints, but that will be the first priority, just listening and learning from people that have been in the field for many more decades than I have.
Did you have a follow-up?
Yeah, I'm just curious about, we've also heard paramedics, particularly in rural areas, complain about one thing in particular, and that's the wage of on-call, being paid $2 an hour, which makes it sort of not a full-time job, which prevents people from taking these jobs in rural areas. Do you know if you'll take a look at that and possibly increasing that compensation?
Well, Jeremy, that's one of the most significant changes we're making now, which is moving to a new system in many rural communities, creating permanent full and part-time positions across BC. So that's the reform that's occurring now. Just to put it in context, as I think I mentioned, the vast majority of ambulance paramedics previously were on some form of on-call status. And we're moving to more permanent ambulance service, and there's a good reason for that in BC Emergency Health Services. It's that, this is their real demands in the labor market. And there's not a lot of positions that require training and have such high demand and responsibilities where your first job tends to be an on-call job, right? So we need to do a good job recruiting many of the people who will be advancing in those positions. So the old model of the ambulance service depended on communities where there were a lot of people working in the community, where it would be an extra thing people did in small community. But that model is really a 20th century model, and change has been occurring over the last decades. One of my predecessor ministers of health, George Abbott, created working with the system, created the community paramedicine system, which is not so long ago celebrated its 10th anniversary and has been expanded since I've been Minister of Health. The idea is to create in smaller communities jobs where people do other work in healthcare and serve as ambulance paramedics. So that's the direction that we've been going now for 3 years. And we've seen some transformation, and we're going to have to see more, because it's not just an issue of whether the on-call system is justified and whether the standing wages are justified. It's a question of recruiting adequate numbers of ambulance paramedics everywhere in the province. Where we see the most dramatic increase in terms of call-outs That's in Metro Vancouver and in other cities such as Kelowna and Kamloops and Victoria and others. But we still, and critically, have to provide coverage across the province. That's why we made significant investments starting on April 20th last year in 2020 to improve rural ambulance service and being able to move people more quickly during the pandemic. But that issue of providing ambulance services around the province is a central one. It's why we've been taking the actions that we've been taking for the last number of years, moving more people from an on-call model to a permanent full-time or part-time model. And that's clearly the direction of the future. And that was a significant subject of our agreement with ambulance paramedics in 2019.
We have time for one more question today. Our last question is from Mary Griffin, Check News. Please go ahead.
Hi, Mary.
Oh, hi. Thank you so much for taking my question. I just wanted to clarify. So what you're announcing, and I'm sorry if this is a dumb question, is the creation of an additional board with a focus on ambulance services. Is that correct?
So what it is, Mary, is there are two boards now. There's the Provincial Health Services Authority Board and the BC Emergency Health Services Board, but essentially they have the same people on them. I want an Emergency Health Services Board that's focused on the ambulance service. And I've asked Jim Chu to be chair of that board, and that board will be solely focused and solely lead and solely chairing the emergency health services. So that board existed before, but now it's solely going to be focused on ambulance services and providing excellent ambulance services in BC. And we're very fortunate as a province to have such a remarkable person as Jim Chu come and be chair of that board.
Mary, did you have a follow-up?
I do. So just to clarify, so the COO, Darlene McKinnon, is remaining as chair of the board of one of the two boards, the health services. Is that correct? And I'm just wondering, you also have an emphasis on island services as well, too, and why is that?
Well, a couple of, I'll speak about Vancouver Island second. Darlene McKinnon continues to service at BCEHS and at the BC and at the Provincial Health Services Authority. But there's a distinction. The board are appointed part-time positions, and Mr. Chu is leading that board. We have also appointed a permanent. She has received the appointment by interim, and she's coming on, and she's starting on Monday. But Leanne Heppel is going to serve in that capacity. So that's on the management side of it. So there's a board that oversees the management of BCEHS. That'll be led by Mr. Chu. And there's a chief ambulance officer, Leanne Heppel, who will lead the service. And it will be her directly. She won't have other things in her portfolio, and she'll help lead the ambulance service, and in addition to the rest of our leadership team, and of course, our ambulance paramedics, our union, our dispatchers, everyone in the system who's so committed to providing the service to British Columbians. So that's the model, the leadership part of the model of change.
That's all the time we have for today. Thank you, everyone, for joining.
Thank you, everybody.